Did you know a runner can finish a full race on a broken hip and not even know it? That is the terrifying truth about femoral neck stress fractures. The pain feels exactly like a pulled groin muscle. Vague, dull, easy to brush off. So athletes keep training, coaches keep pushing, and the fracture keeps growing. Here's where it gets dangerous. If that hairline crack displaces completely, it becomes a full hip fracture overnight. We are talking emergency surgery. And worse, the blood supply to the femoral head can be cut off permanently, meaning the bone starts to die. Standard X-rays can miss this entirely in the early stages. You need an MRI to catch it. The people most at risk are young female runners, military recruits, and anyone with low bone density. But it can happen to any high-volume athlete. The warning sign to never ignore is groin or inner thigh pain that gets worse with running and does not go away with rest. That is not a muscle strain. Get it checked. Follow for more warning signs your body is trying to tell you.
Did you know a small fracture in a child's bone can cause permanent damage that doesn't show up for years? Here's what most parents don't know. Children have something adults don't. They're called growth plates. These are soft zones of cartilage near the ends of bones, and they're responsible for how your child's arms and legs grow longer over time. The problem is that growth plates are the weakest point in a child's skeleton, weaker than the ligaments, weaker than the surrounding bone. So when a child falls and injures a limb, the growth plate can be damaged even when the X-ray looks almost normal. And here's the part that keeps pediatric orthopedic surgeons up at night. That injury can quietly disrupt bone growth for months or even years after the fracture heals. One leg grows shorter, an arm angles the wrong way. The fracture is long gone, but the consequence is just arriving. Kids don't heal easier, they heal differently. And sometimes that difference has a cost. If your child injures a limb near a joint, always get it evaluated by a specialist. Follow OrthoFacts with Dr. O for more orthopedic facts every parent should know. Educational purposes only, not medical advice. See a healthcare professional for evaluation.
Did you know your bone can be dying right now and your X-ray looks completely normal? It's called a vascular necrosis, and it happens when blood supply to a bone gets cut off. Without blood, the bone starts dying from the inside out, silently. No alarm, no obvious sign, just slow collapse building underneath the surface. Here's the part that stops most people cold. One of the biggest triggers is steroids. The same medication doctors prescribe every single day for asthma, allergies, back pain, arthritis, autoimmune conditions. Millions of people receive steroids and are never told this is even possible. The bone most commonly affected is the femoral head, the round top of your hip bone. By the time pain starts, significant damage has often already happened. By the time it shows on X-ray, collapse may already be underway. This isn't a rare disease hiding in medical textbooks. It's a common consequence that just doesn't get talked about. If you've had repeated steroid treatments and your hip or groin aches, don't wait. Which part of this surprised you most? Drop it below and follow for more. Did you know that the most common bone cancer in teenagers gets mistaken for growing pains for months? That delay can cost everything. Osteosarcoma usually shows up between ages 10 and 20, right when kids are growing fast and playing hard. So when the pain starts, everyone assumes it's normal. But here's the pattern you need to know. The pain is deep. It aches. It's worse at night, bad enough to wake you up. And it doesn't go away after a few days of rest like a sports injury would. Then comes the swelling. A firm, visible lump near the knee, the shoulder, or the upper arm. Not soft like a bruise, hard, fixed, and the limp that keeps getting worse, not better. The rule is simple. Bone pain plus night pain plus a lump equals call a doctor today. Not next week, not after one more game. Teenagers do get serious bone disease. Knowing this pattern is what changes the outcome. Follow for more signs your body is trying to tell you something important. Which of these signs have you or someone you know brushed off before? Did you know your body might already be solving a spinal problem without you even realizing it? Here's what happens. You start walking. Maybe half a block, maybe one aisle at the grocery store. Then your legs get heavy, weak, almost numb. You stop. You sit down, lean forward, and within seconds, it is gone, like it never happened. Most people call it bad legs, or just getting old. But there is a name for it. Lumbar spinal stenosis. Here is the strange part. Your spinal canal is narrowing, slowly squeezing the nerves inside. But when you lean forward, the canal physically opens up and the pressure lifts. That is why people instinctively hunch over a shopping cart. Their body already solved the geometry before their brain figured it out. This is not normal aging. It is a structural problem with a very specific signature, and it is treatable. If walking a short distance makes your legs fail, but sitting forward makes it stop, tell your doctor those exact words. Follow for more signs. Your body is trying to tell you something.
Did you know your cartilage has 0 blood vessels running through it? None. And that one fact changes everything. When you break a bone, your body floods the area with repair cells carried by blood. New bone grows. The fracture heals. The body knows exactly what to do. But cartilage is different. There are no blood vessels. So when it gets damaged, no repair cells show up. Nothing arrives to fix it. The damage just sits there, quietly getting worse with every step you take. That is why arthritis is not like a broken bone. It does not heal. It does not reset. Orthopedic surgeons spend entire careers trying to work around a problem the body genuinely cannot solve on its own. So when someone tells you to protect your joints, this is what they mean. It is not vague health advice. It is biology. Once that cartilage is gone, it is gone. The rules of the game have completely changed. Follow OrthoFacts with Dr. O for more orthopedic facts that could protect your joints for life. Educational purposes only, not medical advice. See a healthcare professional for evaluation. Did you know a small fracture in a child's bone can cause permanent damage that doesn't show up for years? Here's what most parents don't know. Children have something adults don't. They're called growth plates. These are soft zones of cartilage near the ends of bones, and they're responsible for how your child's arms and legs grow longer over time. The problem is that growth plates are the weakest point in a child's skeleton, weaker than the ligaments, weaker than the surrounding bone. So when a child falls and injures a limb, the growth plate can be damaged, even when the X-ray looks almost normal. And here's the part that keeps pediatric orthopedic surgeons up at night. That injury can quietly disrupt bone growth for months or even years after the fracture heals. One leg grows shorter, an arm angles the wrong way. The fracture is long gone, but the consequence is just arriving. Kids don't heal easier. They heal differently, and sometimes that difference has a cost. If your child injures a limb near a joint, always get it evaluated by a specialist. Follow OrthoFacts with Dr. O for more orthopedic facts every parent should know. Educational purposes only, not medical advice. See a healthcare professional for evaluation.
Did you know your spine could be slowly fusing together right now and your doctor might just tell you to stretch more? This is ankylosing spondylitis, and it loves young men in their 20s. Here's what makes it so easy to miss. The pain gets worse at night and with rest. That is the opposite of a normal back injury, so doctors brush it off. Posture problems, they say. Stress, they say. And standard X-rays show nothing in the early stages. Nothing. So there is no proof. Just a young person in pain who looks completely fine on paper. The average time from first symptom to correct diagnosis is close to a decade. 10 years of your spine quietly stiffening while you were told you were overreacting. So here are the real red flags. Back pain that starts before age 40. Pain that wakes you up at night. Stiffness that actually improves with movement. Morning stiffness lasting more than 30 minutes. And pain in the sacroiliac joints, right at the base of your spine. Young people with back pain are not a non-story. They are a warning sign. Follow for more signs. Your body is trying to tell you something important.
Did you know a bone can be fracturing right now and you would feel nothing but a dull ache? That is exactly what a stress fracture is. No snap, no fall, no dramatic moment. Just a quiet crack building inside your bone over days or weeks. Here is why it happens. Your bones are always repairing themselves. Every time you run, jump, or lift, tiny bits of damage form inside the bone. Normally, your body patches that damage fast enough to keep up. But when you push too hard, too often, without enough rest, the repair crew falls behind. The damage piles up faster than it can be fixed, and the bone slowly starts to fail from the inside out. The warning sign is a pain that gets worse the longer you stay active and better when you rest. It often does not show up on a regular X-ray for the first 2 weeks. If you keep pushing through that kind of nagging soreness, a stress fracture can turn into a complete break. Take the ache seriously before your body forces you to. Follow OrthoFacts with Dr. O for more facts that protect your bones. Educational purposes only, not medical advice. See a healthcare professional for evaluation.
Did you know your shoulder could slowly lock itself shut over 2 years and doctors still don't fully understand why? It's called frozen shoulder. And if you're a middle-aged woman or you have diabetes, your odds of getting it are surprisingly high. Here's what's actually happening. The capsule around your shoulder joint starts to thicken and tighten. Scar tissue builds up. The space inside shrinks, and movement becomes agony. It moves through 3 stages. First comes the freezing stage. Pain hits hard, often at night, and motion starts slipping away. Then the frozen stage. Less pain, but your arm barely lifts. This phase alone can last over a year. Finally, thawing. Slowly, movement creeps back. Here's the cruel part. Protecting your arm and staying still actually feeds the problem. The joint needs movement to heal, but movement hurts too much to do. Most people lose months before they even get a diagnosis. If your shoulder has been aching and stiffening for weeks with no clear injury, this could be it. Follow for more signs your body is trying to tell you something important. Which stage sounds most familiar to you? Drop it in the comments.